In today's topic, we will be discussing about nutrition and food requirements for lactating mothers. Okay. So if anyone is joining late, please help them out with the page numbers. You can mention the page number in the chat box. It's page 167. Those who have the new textbook, page 167, chapter 9. If anyone joins late, please help them out with the page numbers. So lactogenesis, okay, that is the word for milk production. Lactogenesis, okay. So lactation means it is a process of making human milk, okay. And human milk is definitely secreted from the mammary glands, breast, okay. Mammary glands are located in your breast, okay. And it is completely hormone-driven process. The entirety of making milk and also the secretion of milk, production of milk and the secretion of milk, both depends on hormones, okay. Hormones which pregnant women naturally produce, okay. And in certain situations, it can be induced as well. These hormones can be injected to induce lactation as well, okay. As long as you continue to uh, breastfeed the child, lactation will take place. Natural suppression of lactation will occur only when you stop breastfeeding the child. Okay, when there is no stimulation on the nipples, when the child is sucking on the nipples to draw out the milk, when there is no stimulation like that, that's when the lactation stops on its own. Okay, so until you stop it, natural suppression of lactation will not take place. Okay, so if you see the breast here, okay, there are these glands that you see, these small cloud-like structures, these are the alveoli. Okay, here the milk is produced and the ducts are there. If you can see, there are small ducts that that end into the nipple. Okay, that converge into the nipple, and the child is able to suck out the milk. Okay, and this alveoli is surrounded by fat, the breast fat. Okay, which is very important in milk production as well. Okay. So there are stages in lactogenesis or milk production. Alveoli, it's the tiny grape-like structure. It's a small cloud grape-like structure. Okay, this is where the milk is produced and stored. Okay, milk ducts. Okay, there are around 20 lobes through which milk comes out. The freshly produced milk comes out through the alveoli. Okay, the outer part of the breast, which is visualized from outside, the dark area, the entire dark area is the areola, and the erect part is the nipple part. Okay, that's how the anatomy of a breast is. Inside there is alveoli and milk ducts and fat tissue. Outside there is just the areola region, which is that dark color. Okay, and the erect part, that is the nipple part on which the child has to suck. And also there is a sucking process. Okay, that goes when we will take pediatric nutrition classes. So the initial few chapters in pediatric nutrition, that's for the pediatric nutrition students. Okay, there is a way how a child should latch onto the mother's breast. Okay, there is a latch score and all that is given. Okay, the child should completely take the areola region inside while the child is sucking. Only then the child's face will develop well. Okay, for the child to grow up with a very strong jawline, a very good set of pair of teeth, okay, proper strong gums, To have a really good jawline, okay, the child should have a really good latch score while the child is being breastfed. This doesn't happen when you are bottle feeding the child. Okay, children who are bottle fed a lot, they don't develop a really good jaw structure, facial structure when they grow up. Okay, there is no robustness, okay, in their face. But the children who are exclusively breastfed and very rarely they were put on bottle feeding and all, they develop a really robust, strong face structure, a very strong jawline, okay, which adds to the attraction of the face as well. Okay, when they grow up, uh, the facial attraction, it depends on your jaw structure, the facial robustness and all. So the children and also the children who have malformations in their teeth, okay, malocclusions and all, those who are orthodontist here, dentist here, they can understand. Okay, when the teeth are crowded, okay, when children have crowding on the teeth, it means their breastfeeding was not done properly. Okay, usually it is seen children who are just breastfed exclusively and they were kept away from uh, bottle feeding and all. They really have a good set of teeth coming up, even the uh, permanent ones. So that is the anatomy of breastfeeding. And coming to lactogenesis, initially there are stages of lactogenesis, which in detail we have discussed in pediatric nutrition classes. But for all the diploma level students, you have to understand there are three major areas here. In stage one, when the child is sucking onto the nipple, okay, that sensation, the neurons present in near the nipple area, that creates a sensory reaction in the hypothalamus of the mother. Okay, and from the hypothalamus, uh, the posterior pituitary will get stimulated. Hypothalamus, in response to the stimulation in hypothalamus, the posterior pituitary will release oxytocin. Okay, and along with that, at the same time, anterior pituitary will release prolactin. Okay, what is posterior pituitary gland? It's a P-shaped gland. Okay, you can see here the shape of the pituitary gland. Anterior is in the front part. Posterior is in the behind part of pituitary gland. Okay. So they secrete two different types of hormone. When the hypothalamus is getting stimulated because of the sucking sensation, okay, when the child sucks onto the mother's nipple, okay, because of that sucking sensation, hypothalamus is stimulated. And because the hypothalamus, you can see here, hypothalamus is just very near the pituitary gland. Okay, when that gets stimulated, automatically your pituitary gland will also get the stimulation. Okay, the posterior pituitary, the back side of the pituitary gland, will secrete oxytocin. Okay, and anterior pituitary will secrete prolactin. So one is letting the milk out of the nipple. That is oxytocin. Because of oxytocin, milk will come out of the nipple. Okay, and because of prolactin, milk is produced. Okay, so when the child stops sucking after the age of 2 and all, up till the age of 2, the child uh, will receive the breast milk. Okay, after that, naturally you have to suppress the breastfeeding. Okay, so when you deny the child uh, of breastfeeding, there is no sucking response on the nipple. So there will be no uh, production of oxytocin and prolactin. So neither the milk will be let down, neither the milk will be produced. So that's the way how it is naturally suppressed. Okay, but when you continue breastfeeding, the more the child, the frequently and the more the child uh, is breastfed, okay, more milk will be let down and more milk will be produced as well. And for milk production, fat is required. Okay, the mother's body should have adequate fat for milk production. So that's why during breastfeeding, during the that 2 years of breastfeeding, mother loses a lot of weight. Okay, whatever weight she has gained during her pregnancy, that is lost during breastfeeding. okay, because the fat is used up to produce milk, okay. So that's how lactogenesis takes place. Is it clear to all? During the early pregnancy time itself, prolactin hormone is produced, okay? And because there are high levels of estrogen and progesterone and other pregnancy related hormones, they suppress prolactin. But prolactin production is happens when you're pregnant, okay? But once you give birth, okay, once the baby is out, once the placenta is out, there is no more placental hormones, okay, that are suppressing prolactin. Now there is nothing to suppress prolactin. That's when soon after birth you start production of milk, okay. So hormones that act during lactation, estrogen produced by your ovaries, it stimulates the breast development. During your pregnancy, okay, levels of estrogens are high and that develops the breast. Okay, breast size increases during pregnancy because more fat deposition takes place. Okay, the additional food that the mother is having, the additional fat intake the mother is having, that will be stored around her breast, her hips, okay, so that it aids in milk production. Progesterone is secreted by the placenta. It also prepares the breast for milk production, okay, but because there is high levels of estrogen and progesterone during pregnancy, progesterone that is secreted by placenta during pregnancy, prolactin cannot function, okay, and oxytocin will also not be released. These two hormones will be suppressed because there are high levels of progesterone. But once the delivery is done, placenta is out, there is nothing to suppress prolactin and oxytocin. And once, as soon after birth, within 1 hour, okay, even if it is C-section, normal birth, or even if it is C-section, within 1 hour, you have to breastfeed the child. Breastfeeding has to start. Okay. So initially, it's not the milk that comes out. Initially, when the child is being breastfed, soon after birth, within that 1 hour, it's usually colostrum. Okay, colostrum is more. It has more fat and it has more water content in it. Okay, and it's filled with immunoglobulins. Okay, after a few days, the actual milk production will start. So milk suppression is also natural milk suppression. Lactation, always remember, it's a supply and demand process. Okay. When the child does not demand breast milk, you don't supply breast milk, and naturally the milk production will be suppressed. Okay. Medications can also be used for suppressing milk production. So nutritional requirements, just check in your textbook if the numbers are still the same or have they changed the data. Okay, so energy, whatever an adult woman on a regular basis has, if this adult woman has a sedentary lifestyle, moderately active lifestyle, or a very active lifestyle, depends on that. Okay, plus 600 kilocalories, that is one additional meal. Saying 600 kilocalories means an additionally new meal she has to have. Okay, if during pregnancy she was just having 3 meals, during lactation she has to have 4 meals. One additional meal she has to have. Okay, for the first 6 months. Okay, at least 600 high calorie dense diet she has to have during the first 6 months because she is exclusively breastfeeding. The child is completely dependent on breast milk for the first 6 months. Okay. So for the first 6 months, the additional calorie intake is slightly high. Okay. Then when you start your weaning diet for the child, okay, till the child's first birthday, okay, just 520 calories, that is round up around 500 kilocalories can be consumed. Okay, but because you have started introducing new diet in the child's palate, okay, so you can reduce 100 calories from your diet, you can reduce. Okay, so that is the energy requirement. Protein 55 is the standard, plus 19 gram or 20 gram. Take it around up as a 20 gram. So approximately 75 grams of protein on a daily basis, or you can target 80 grams. If you target 80 grams, you can at least consume 70 to 75. And since there are 4 meals, one additional meal is there during the pregnancy. So if you're targeting 80 grams, it's better because you can have 20 grams of protein in each meal. Breakfast, lunch, dinner, and the additional meal that you're having, in that also 20 grams of protein you can have. Okay. So if you're targeting it as 80, it's well and good. Okay. And again, the protein requirement also depends on the mother's activity level. Okay, if the mother has a very sedentary lifestyle, 80 grams are fine. But if she has a moderately active to active lifestyle, then definitely the protein requirement will be higher than that. Okay. Fat, around 50 grams on a daily basis, she can consume. 20 gram is the baseline. 20 to 25 gram of fat on a daily basis is just a baseline for a sedentary woman. Okay, but during lactation, additional fat content should be there in the diet. Okay, you have to maintain the fat content in your body. Okay, your diet cannot be fat free. To lose weight that you have gained during pregnancy, you cannot go fat free during lactation, because that will affect the quality of your breast milk. Okay. Calcium intake is 1200 mg. Just check in your textbook what is the calcium that they have given, because calcium, it frequently changes. Yeah, protein can be 47 plus 17. It's like it could be a difference of just 10 grams. Okay, it's not big deal. Calcium, just see. And again, protein requirements is completely dependent on your activity level as well. Okay, just see, is it 1000 or 1200 mg of calcium for lactating women? Okay, it is between 1000 and 2200. People are giving two numbers here. But I think so for lactating women, it has to be higher, because if you are lactating, milk should have calcium. And if your milk does not have enough calcium, that calcium will be taken up from your bones. 1000 mg is for normal woman, even for normal adult. Okay, 1000 mg will be there. Exam related queries, please keep at the end of the session, not in between. 1200 is for lactating women. Okay, otherwise bone demineralization will take place. Okay, according to ICMR 2020, 1200 mg of calcium per day has to be taken. That means you have to have at least 1 liter of some or the other form of dairy product, either milk, buttermilk, curd, yogurt. Okay, 1 liter of dairy product should go in your diet. to meet the high calcium requirement. If the calcium requirement is not met, you will lose the calcium content from your bone. The woman will lose calcium content from her bone, and also the child will not have enough calcium through the breast milk. Okay. And the child's calcium stores will also be affected. Iron content 26 mg. Just again check iron as well in the textbook. During lactation, you don't have to worry much about the iron intake, because again, during that exclusive lactation, you are not menstruating. So there is not much loss of iron during lactation, just like during pregnancy. When the woman starts menstruating, then yeah, she has to increase the iron intake. Okay. Yeah, for lactating, you don't have to worry much. 23 grams of iron is fine. Normal woman will have higher intake of iron because she is lactating. Sorry, she is menstruating. Okay. Normal woman in the reproductive age group, normal woman, non-pregnant or non-lactating woman in the reproductive age group will be menstruating. So there will be loss of blood, loss of iron. So their intake should be higher. Okay, during pregnancy and lactation, you are not losing iron. You are just consuming during pregnancy. Your iron consumption is that your blood should not get diluted. Okay, to prevent anemia in pregnancy, because there is the blood volume increases. So you have to keep up with higher production of red blood cells. To increase the production of red blood cells, more iron is required. Okay, that is the requirement for pregnancy. In lactation, it's not that high. Okay, the blood volume does not increase during lactation. It is coming back to normal. Amenorrhea means absence of menstruation. Amenorrhea means no menstruation. Menorrhea means it's menstruation. Okay, so amenorrhea, absence of menstruation, no periods. Then vitamin A, additional 350 micrograms of vitamin A that the woman will get from her additional meal that she is taking. The one extra meal that she is taking, that will satisfy the requirement of vitamin A. Vitamin B, again, you can check the page number. Page number may slightly change, but you can check the table that has been given in this chapter. So thiamine, riboflavin, niacinamide, okay, all the different forms of vitamin B complexes has been mentioned. Just have one handful of groundnut, peanut or groundnut, just one handful of groundnut or peanut. That's it. Okay, that is fat rich, that has protein, that has fats, and that also has vitamin B complexes. Okay. So have one handful of groundnut on a daily basis. It's calorie dense as well. Then vitamin C, she has to have fresh fruits and vegetables more. Okay. So 80 microgram on a daily basis. The number will be slightly different in your textbook. Maybe ICMR has recommended much more vitamin C in the recent updates. Please cross check that. What is the total amount of vitamin C required? At least 2 to 3 servings of fruits. So 105 mg total. So definitely it is much higher. 2 to 3 servings of fresh fruits and vegetables. Consume more green chili chutneys. Okay, green chili, coriander chutney. Okay, The fresh chutney that we make, green chili, garlic, coriander leaves, mint, and a squeeze of lemon. Okay, make this chutney, have it with chapati or even with whatever breakfast, chila, chapatis. Okay, any bread that you consume, because green chilies are also really good source of vitamin C. Okay, and chutneys, you can make it in your own way. Every household will have their own recipe of making chutneys. Okay, so having chutney, because you are not cooking it much. Okay, you're just grinding it and you're consuming the vitamins and minerals in the fresh form. Okay, consume fresh chutneys, you will get vitamin C as well. Fluid, at least 2 to 3 liters of fluid per day. Just don't be dehydrated. Okay, based on your weight and your activity level, consume enough fluid so that you are not dehydrated. Milk production requires fluid. It requires fat, it requires water. Okay, a dehydrated mother will not produce enough quantity of milk. Okay, the child will also be dehydrated. So don't be dehydrated, avoid dehydration. Is all the nutritional requirements clear to all? So when it comes to the guidelines for lactating mother, maximum requirement of healthy diet with enough calories is during lactation, not even during pregnancy. Lactation is the phase in a woman's life that she should have the highest amount of food. Okay, more than what she had as a child, as a teenager, as a young woman, as a pregnant woman. Okay, in whatever biological phase of her life she has been through, lactation is the period in a woman's life when there is a maximum requirement of food and nutrition. Okay, and if she is having low calorie diet, that will decrease the milk supply as well. And balanced diet. Balanced diet means what? It's a very easy term to say balanced diet. But if somebody asks you, will ask you, what is the meaning of balanced diet? We hear balanced diet every day. Okay, what is the meaning of balanced diet? What would you answer? What do you think is a balanced diet? What is the answer that you will give when your client in future will ask you? Have a balanced diet is a general statement that we give for everyone. But what is the right proportion? Right proportion is different for everyone, right? Yes, a balanced diet is the one that has all 5 food groups. Okay, a diet that contains all 5 food groups. And what are the food groups? Balanced diet should have all 5 food groups. Okay. What are the food groups? Next question they will ask is, what are food groups? I'm listening for this term for the first time. I don't know what is food groups. That would be the question from your client. So what should be your answer? Never. Carbohydrates, proteins, fat, fiber, they are not food groups. They are nutrition. Nutrition is different from food. How? Nutrition is made up of macros and micros. Macros are your carbohydrate, protein, fat. Micros are your vitamins and minerals. They are nutrition. They are not food. Food is your cereals, pulses, legumes, dairy products, fruits, vegetables, all the different fat that you use, sugars that you use. These are the five food groups. Okay. In India, there are two different pyramids that we use, the four food group pyramid, five food group pyramid. The five food group pyramid is the better one to use. Okay. Cereals, pulses, legumes, dairy products, fruits and vegetables are in one group. Okay. Dairy products are in one group. Fat, oil, and sugar is in one group. Cereals are in one group. Pulses, legumes are another group. In dairy product, you can add meat as well for a non-vegetarian. Dairy and meat will come in one group. Okay. So that is a balanced diet. All five food groups should be there. Okay. Carbohydrates, proteins, fat, they are not food groups. They are nutrition. Okay. Different beverages should be incorporated. Fruit juices, smoothies. Okay. For some women, having 3 meals itself is difficult. So if you're giving them 4 meal day plan, okay, 4 meal a day plan, it would be exhausting for them. Okay, some women, uh, majority of the women who live in nuclear families, okay, just the husband, wife, and kids, to make uh, with a child that she has to take care of, an infant, a toddler that she has to take care of. Okay, in majority of the households, there is not much help from the husband's part. They also may be busy with their work. Okay, so being a working woman, taking care of the toddler, making sure the meal is also served to the family, and she should also have an extra meal for herself. It would be very exhausting. Okay, so always make sure your client's convenience is of importance. And drinking different beverages, for example, if you give her a recipe of a smoothie, of a fruit smoothie or a vegetable smoothie with milk, um, milk and some fresh fruits, okay, yogurt, okay, everything is mixed in a smoothie, easy to do recipes, okay, which does not require extensive cooking and all, okay, so that can meet their calorie requirements. Okay, it is also nutritionally dense, smoothies and all. Okay, nutritionally dense, vegetable soups and all. Okay, it does not require much cutting, chopping and all. Okay, whatever food the lactating mother has, if she is on her own, it should be easy to do, quickly available, should not take too much time in the kitchen because she has to take care of the child as well. So beverages are a really easy way. Milkshakes, lassi, okay, these are beverages that will give her the calorie that she requires. Since you use milk and yogurt, okay, in these kind of recipes, it naturally has fat as well. Fruit juices and all we will not recommend because fruit juices don't have fat. Okay, fat content, you have to at least give 50 gram of fat per day. Okay, they don't have fat content. Okay, so whatever food that she has cooked, if she has one tablespoon of ghee on top of it, okay, that is also fine. Uh, it is making the food calorie dense. So, like these tricks she has to use if she can't make an entire meal for herself. 1 liter of milk every day or milk substitute. At least 500 ml, half a liter of milk she should take. It will give her calcium requirements, protein requirement, and also calorie requirement will be met. Okay. If she does not like to take milk, you can mix it up with smoothies, fruit shakes, milkshakes, and all. Okay, that is also an easy way to sneak in milk in her diet. And instead of water, she can have 2 glasses of buttermilk. When she feels thirsty, she can have buttermilk. Okay. Increase the quantity of the food, that is one entire meal usually should be increased, and add more variety. Don't make the meal plan monotonous. Okay, variety should be there. Supplements can be taken if, which is convenient. Okay, if taking supplements is convenient, is the most convenient way to uh, sail through the lactation period, that's the best way possible. Otherwise, if some people may have a certain um, judgment towards taking supplements. Okay, so in that case, if it does not fits if taking supplements don't fit with their principles, only then let them have full meals and all. It is a difficult process. Okay, it may not be convenient, but for women who are working, who can't spend a lot of time cooking for themselves or making sure that the dietary requirements are met during lactations, if supplements can help, okay, they can definitely take it with the advice of the physician. Teenage mothers and women who are dealing with multiple pregnancies like twins, triplets, quadruplets, okay, and teenage pregnancies. Okay, we consider these two cases as high risk pregnancies. Okay, special care has to be given for their nutrition. Apart from that, whenever the mother has to breastfeed, make sure uh, she's feeding the child on demand, nursing on demand. Or if she is using breast pump, every 4 hours, approximately every 4 hours, she has to use the breast pump. So in this way, she can maintain the milk production. Okay, like working mothers, if they have to leave their child at daycare center or with their family and go to work, so they have to make sure they take their breast pump to their work as well, and every 4 hours they are pumping the milk. Okay, so in this way they are maintaining their milk flow. Otherwise, if you are working 9 to 5, if you are working 9 to 5, you're leaving your child at daycare center by 8 or with your family by 8, you come back to your child by 6. Okay, so there is a big gap uh, in that in which you are not feeding your child. Okay, so this big gap between the mother and the child can also suppress mother's milk production. Okay, so in such cases, if you're a working mom who is lactating, it's advised to take breast pump to your office. Okay, and this is the reason why nowadays in offices as well, the breastfeeding launches are available. Okay, in a female launch or female's restroom is available, where within your privacy you can pump your breast milk as well. Okay, for 24 hours you can store breast milk outside. Depends on the climate as well. If it is a cool climate or if your office has air conditioning and all, you can store it outside. You don't require refrigeration. You can bring back the milk home and it can be fed to the child. Okay. And avoid smoking, drugs, alcohol. These factors can also suppress your breast milk production. During lactation, avoid smoking, any form of drugs and alcohol. Lactogogues. Lactogogues are certain food that is supposed to enhance your milk production. Okay. For example, you can see here mm, oats, garlic, almonds, methi seeds, coconut, poppy seeds, kaskas. Okay, leafy vegetables, gond that is used to make laddus. Okay, dil seeds, and even fennel seeds. They have not mentioned it here, but fennel seeds also help in production of breast milk. Okay, and even in India, in different parts of India, methi ke laddu that is given during lactation. I don't know. I think not in South India, but in northern part of India and Western India, it's very common to give methi laddus. These methi laddus are made up of methi powder, fenugreek powder, and goond, okay, and other nuts as well for taste factor. Okay, it is slightly bitter in taste. So that is the methi laddu. I hope you have heard about it, or even mothers who are attending the class here, your mothers or your in-laws or your grandmothers may have made that methi ke laddu. Okay, so what is the purpose of giving methi ke laddu? It's a uh, yeah, methi kanjis are also available. So usually fenugreek seed is very popular among lactating mothers. Okay, fenugreek seeds. And if you are in North India, Gond and all, Gond is not much used in southern parts of India. Okay, I think in Karnataka, poppy seeds are used. Poppy seeds are used. Okay, and even if the mother consumes poppy seeds, the child will also sleep for a very long time. Okay, mother who consumes poppy seeds, the child will sleep for a lot of time. It acts like a sedative as well. Yeah, curry leaves. Every region has their own way of identifying lactogos. Dry ginger, but methi is a common factor in majority of the regions. Methi, poppy seeds, and fennel seeds. Okay. If you use any other lactogogues or which you have tried, or which your family uses, or your region uses certain foods as lactogogues, you can mention it here. Only some limited examples I have shown on screen. So that's about lactogogue, okay, that this enhances the breast milk production. It could be placebo as well. We do not know. Okay, but it could be placebo as well. The mother may think that, okay, I'm having enough methi, I'm having enough of these regional foods that are supposed to, that my grandmothers and my mothers have used. They have, based on their experience, it produces good quality breast milk, so it could have a placebo effect as well. Okay, but not all the examples that we are seeing here and on screen are supposed to enhance the breast milk production, but it may give a placebo effect as well. Okay. So coming to food requirement, weight management has to be done for women who are obese. Okay. You cannot ask them to have additional meal. Okay, if they are already suffering from obesity, in that case additional meal cannot be given. Okay, but you can do something here, that is, you are giving them low calorie food but which is nutritionally dense. Low calorie food but which is nutritionally dense. Lots of vegetables and fruits, legumes. Okay, sprouted legumes and all. When they consume that, nutritionally they are ticking all the boxes, but the calorie wise they are achieving their weight management as well. Okay, so that you cannot ask the lactating mother, even if she is obese, to cut down on her meals. Okay, because nutrients has to reach in one or the other way. Okay, how much calorie should be there, you can control it, but nutrients has to reach. So nutrient dense food has to be given. So a lot of complex carbohydrates, millets, okay, sprouted legumes in general, boiled legumes. Okay, even if she is obese, at least 30 to 35 gram of fat intake should be there. Caffeine, you can limit caffeine just to 2 cups. Okay, morning, evening, either tea or coffee, but not too strong tea or coffee, because too much of caffeine in your diet can also go into your child. Caffeine can pass through your breast milk towards the child, and it can cause irritation in your child as well. And even dark chocolate, okay, not just caffeine, having too much of dark chocolate, that also has the same effect. It can pass through the breast milk into the child, dark chocolate, the irritant that is found in the dark chocolate, okay. And the child will cry a lot, will show a lot of tantrums, okay. The child will have a very irritant behavior because of this. Some allergenic food has to be avoided, like in the past, if she has some allergies or intolerances with peanuts or any form of nuts, seafood, okay, if you know it is allergic, it may cause you allergy, avoid it, okay. Certain contaminants, so avoid eating a lot of junk food, avoid too much of packaged food. Make sure from wherever you are eating your meal, hygiene is practiced in those kitchens, okay. Expressed milk, you can definitely store it, okay. Expressed milk, if it is kept outside, you can store it for 24 hours without getting bad, but it depends on the climate as well, not in summers. And if you're freezing your breast milk, you can store it up to 6 months. If you're refrigerating it, up till 48 hours, you can use it, okay, before it goes bad. Then we have human milk bank. So this concept is also very new, okay, in India as well. So mothers who have lost their child during childbirth, okay, they will at least still be lactating. They can also um, give give their breast milk. They can pump. They can regularly pump their breast milk and supply it for children who may have lost their mothers during childbirth, or children who are born to HIV positive mothers. Okay, HIV virus can pass through human breast milk as well. Okay, so children born to HIV positive mothers, they can benefit from human milk bank. Okay, the first human breast milk bank was established in the year 1989 in Sion in Mumbai. Okay, and wherever there is an NICU, whichever hospital has an NICU, they do have an association between human milk bank, the nearest one, or the NICU will also have their own branch of human milk bank. So that is also a good cause of donating breast milk, and some mothers who are producing excessive amount of breast milk, okay, they can feed their child, and the remainder of the breast milk they can pump and provide it to the milk bank as well. Okay, mothers who have lost their children in childbirth, if they are able to manage to pump out the colostrum, okay, that would be life savior. Colostrum is considered as liquid gold. Okay, you called colostrum as liquid gold. Like colostrum is the breast milk that comes in the first few days after delivery. Okay, after that there is no more colostrum produced. So it's very important to get that colostrum. It is rich in antibodies and immunoglobulins. Okay, it is the first shot of immunity that the child gets soon after birth. So mothers who have lost their children during childbirth, they can supply their colostrum for the to the nearest human milk bank. That can save a lot of children. Okay, it's getting that colostrum is very important. So there are different temperatures in which fresh breast milk is stored. Okay, it can be stored at room temperature for 3 to 4 hours. Okay, in hot climate, in a climate like India, maximum 6 hours you can store it in room temperature. If you have air conditioning at your home, Okay, it can go up to 12 hours. If it is a cold winter months, 24 hours also it can stay out. It will not go bad. Okay. 4 to 8 degrees Celsius in refrigerator. If you're freezing it, you can keep it for 6 months. And if you have a deep freezer at your home, and from home you have decided to donate your breast milk, okay, at home you can deep freeze your milk at -4 to -8 degrees Celsius. If you are at home and you want to donate the breast milk, okay, you can pump the breast milk, store it at -4 to -8 degrees Celsius in your home's refrigerator, okay, deep freezer. If the refrigerator has a deep freezing mm, session, okay, in that you can store it, and then you can supply it to the you can take a cold chain and you can supply it to the bank, milk bank. And also you have to mention the date on when you have expressed the breast milk. That has to be mentioned on the label, on which day you expressed the breast milk. Special containers do come that you can get from the milk bank itself. If you can go and place an order, they will give you the container in which you have to store, how to wash it, how to reuse it. They give you clean and sterile containers for this purpose. Food grade plastics are also used. Sometimes it is stainless steel and sometimes it is food grade plastic used for milk donation. Exercise, aerobic exercise, moderate intensity aerobic exercise can be done during lactation. Climbing the stairs, brisk walking, treadmill walking, cycling, swimming. Avoid contact sports, okay, but aerobic moderate intensity exercise can be done. Lactation failure, there could be numerous causes, okay. Certain medications that mothers take could also lead to lactation failure, okay. For example, if she's on antidepressants, okay, certain psychiatric drugs, antipsychotics, okay, that could also lead to lactation failures. And if the child is not able to latch onto the mother's nipple properly, okay, because it is because of the child's proper sucking, okay, it has to be the sucking also should be strong, like it's said that when the child is born, the first time when the child latches onto the breast, it should be audible. The way how the child is sucking, that suckling sound should be audible, okay. So that's a good latch that gets the highest score on latch, okay, that's a latch score. So if the child is not able to latch properly, that can also lead to lactation failure, okay. Low milk supply, okay, uh, say not feeding the child frequently, okay. If there is a distance between the mother and the child, the mother is kept far away from the child for long periods. For example, if it was a high risk pregnancy, both the mother and the child was in ICU, okay, child was in NICU, mother was in uh, obstetric ICU, okay, they are not seeing each other, they don't have that physical contact for a long time, that can also lead to lactation failure, okay. And the mental health also plays a lot of role in lactation failure. Not having enough confidence for lactation, okay, feeling shy for towards lactation. So these behavior can also lead to lactation failure. Certain medications, anti-cancer drugs can cause immunosuppression, okay, in a lactating mother. Anti-thyroid medications, which have iodine, that can damage the thyroid tissue of the child. Okay. Cancer drugs can suppress the immunity in the child if the mother is taking these medications during breastfeeding, or if the mother is on these medications. Antithyroid medications are taken by mothers who suffer from hyperthyroidism, not hypothyroidism, hyperthyroidism. So those drugs can damage the child's thyroid tissue. Ergotherapy is used in migraines. Mothers who suffer from migraines, they take ergotherapy. So if you're taking the ergotherapy, that can lead to vomiting and diarrhea in children. Then oral pills like thiazides, that can also suppress lactation. It's a diuretic. Thiazide is a diuretic. It is used for people who suffer from high blood pressure. Okay. Laxatives can give diarrhea to the child. If mother is on laxative, it can give diarrhea to the child. Antibiotics, if the mother is taking a lot of antibiotics, it can give GI disorders to the child, like diarrhea, vomiting, stomach aches, gastroenteritis, okay, for the children. So Indian nursing mothers, so far is it clear to all? So Indian nursing mothers, we see a lot of malnutrition in women in India. Okay. So during pregnancy also their weight gain is low. A healthy woman should at least have 10 to 12 kgs of weight gain during pregnancy. Okay. And majority of the women are not able to attain this weight gain because they may have started from malnourishment. Okay. While when they were conceiving, they were malnourished. So if the pregnancy weight gain is low, mothers will not get enough nutrition, the child will not get enough nutrition, and the child will have low birth weight. Okay, low birth weight is a very common problem in India. Okay, mothers, why they are malnourished, or why don't they have proper weight gain? Either they are not given nutritious food during pregnancy, they lack awareness of what is nutritious food that they should consume during pregnancy. Okay, they don't have access to good health care. Okay, they don't have access to good food. Okay, so these all things will increase the rate of maternal mortality as well during pregnancy. During pregnancy and soon after pregnancy, within 42 days after pregnancy, if the mother passes away, that is considered as maternal mortality. Okay, and in some situations, even within the child's first birthday, if the mother passes away due to some health related concerns related to pregnancy, that is also called as maternal mortality. Okay, so low birth weight babies, they also have a higher mortality rate. Okay, the chances to survive, and chances to survive is lower in boys as compared to girls. Okay, it's seen that uh, baby boys, they have a lower chance to survive, low birth weight, small for gestational age, preterm babies. Okay, preterm babies, low birth weight babies who are girls, they have the higher chance, naturally they have the higher chance to survive. That is what it is seen. Okay, but socially they are not allowed to survive. That is another problem. Okay, and low birth weight babies, again, they start with malnourishment. They have to catch up, and some children are not able to catch up to their growth as their peers. Okay, they are not developed mentally properly. Okay, their physical development is also impaired, mental development is also impaired. A child who is born to malnourished mother, a mother who is from a poverty ridden region, okay, a child who is born into poverty, again, will not have access to healthcare, will not have access to good food. Okay. So definitely the child will stay stunted. Stunted means the child has not achieved its potential of growth and development. Okay. So mental capacity is reduced, no good food, no good healthcare. Okay. Frequent infections, not getting proper food from mother or from the after weaning, proper diet from the home is also not available. The child will grow into a stunted adolescent who again is malnourished, and this cycle goes on and on. Okay, adolescent girls are married off. Okay, in India, young girls are married off. Teenage girls who are malnourished, who are not completely developed physically and mentally, they are married off, and again the cycle continues. So this is the loop of Indian nursing mothers. Okay, it's very common issues that we see in India. So according to ICDS, there is a health mix called as Sattu Mavu. In South India, it is called Sattu Mavu, but in Northern India, they may have other name for it, but it is health mix that lactating mothers should have for 15 days. Okay. Soon after they have given birth, there's 160 gram per day Sattu Mavu they should have for 15 days. It is supposed to meet their meal requirement. Okay, this 160 gram per day will give them the required calories, and also uh, it will give them their additional adequate protein intake. Okay, you can see here 160 gram of this per day is giving 600 kilocalories. Okay, equivalent to one meal, and it provides 18 to 20 gram of protein as well. Okay, so this is all Sattu Mavu is made up of. You can make it at home as well. Okay, equal amounts of all these uh, millets, cereals, and legumes and nuts. Okay, if you uh, roast it a little bit, equal amount of all this after roasting it, when it turns aromatic, okay, cool it down, grind it, okay, and then add it to milk or water, mix it properly and have it as a porridge. Okay, so this is the Sattu Mavu mix. You can make it at home as well for lactating mothers. So when you have this, you don't have to worry much about having that additional meal. It's very convenient as well. Okay, is it clear to all? Iron rich food, calcium rich food, and protein rich food is what you have to focus on as a lactating mother. Okay, so some iron rich food sources, all we will see vegetarian sources. Okay, because non-vegetarian source, it is very easy to get iron rich food from non-vegetarian sources. So vegetarian sources, cereals that are iron rich. Okay, rice bran, puffed rice. Okay, rice flakes, that is poha, whole wheat, buckwheat, corn, oats. These are the options. Okay, pulses, chickpeas, red kidney bean, soya bean, black gram, urad dal, Bengal gram, that is chana dal. Okay, moong dal, cowpeas, sprouts, horse gram. Okay, these are the pulses that are iron rich. Not the best source, but they have iron when you consume them together. Cashew nuts, dried coconut, almond, raisins, fig, sesame seeds. Okay. And if you're having tea or coffee, avoid tea or coffee at least an hour following the meal. Okay, have your meal, and after an hour you can have tea or coffee. It will not cause an issue. Okay, and when you're having something that is iron rich, include vitamin C rich food as well. A glass of orange juice, lime juice, amla juice. Okay, the gooseberries, tomatoes. Okay, that can enhance the iron absorption. Coming to calcium rich sources, ragi is the best cereal that is calcium rich. Finger millet, you can see here ragi. Okay, the best calcium rich source. In legumes, kabuli chana, chickpeas, okay, rajma, soya bean, urad dal, chana dal, moong dal. Okay, these all are rich in calcium. Green leafy vegetables are good sources of calcium. Any green leafy vegetables you can take. Okay, dark green leafy vegetables. Almonds, walnuts, and coconut as well. They also have calcium. Not the best source, but they have. Curd, dairy products, curd, milk, buttermilk. Okay, best source, paneer and all. Protein sources, all of you may know, all forms of meat, dairy products are good source of protein. For vegetarians, soya. Okay, so different types of products of soya is there. Okay, tofu, soya beans, so soya chunks, soya milk. Okay, they are different. There are different variety of soya protein. Nuts also have almond, but they also have high fat content. So you have to be you have to restrict yourself with nuts. Okay, you can't go overboard with that. Chickpea, cowpea, horse gram, okay, urad dal, rajma, they are also good sources of protein. Legumes, sprouted ones are even better. So that's about today's session on lactating mothers. If you have any